Hey, good to see you. So we're gonna start probably exactly 11. Okay. And although, if okay with you, if I have like a case that I'm working on, we can just have everybody watch and you see what we do. Okay. So awesome. If I get somebody settled in, I'll have you kind of come and join us. And hello, please come in. All right, let's bring Adamus back and we'll get started. All right, come on back. This is Adamus. He's a longtime patient and he's so used to having people around and kids. Let's just slide over here. All right. Hi, buddy, come here. Okay. So Adamus is here he had some little incontinence. He's also a senior dog. There are a few things some things we consider in senior dogs versus young dogs. So I'm gonna do a full exam and that's, what we do here. So check the eyes for cataract and other abnormalities, teeth for dental problems, and gum circulation. If the gums are pale or bluish or something, that means there's poor circulation. Who is there? Who is there? Who is doing that? Okay. And then lymph nodes are little glands that tell us about systemic diseases. If you have a virus or bacteria or a local infection, they'll be swollen. Then we check the ears for infections. Go ahead and hold on to him for me a minute. This looks deeper in the ear canal. You want to see if you can hold on his face too. Yeah. Now he makes it look easy. But try this on a cat. So I didn't see any growth or polyps or problems or infection. So I'm gonna listen to the heart for abnormal heart sounds and lung issues. Did we ever talk about that little arrhythmia that's in there?
Yeah, she got an echo.
Good.
Yeah.
It's
6 to 8 months ago or so.
Yeah. Okay, let's just check your belly. So Adamus has a little abnormal heart sound. It's an arrhythmia. It's like an offbeat rhythm. The heart is supposed to go lap dap, lap dap. It has a little click sound, so that makes it something questionable. This client treats this dog like a human, so I sent them to a cardiologist and they did an echocardiogram and everything, and we have the report, so he's safe. Dogs have lymph nodes in the back legs, which one of the minor difference between humans and pets, and we check on those as well. He's got a few bumps. Those are fatty masses. We've tested them before, so he's good. And what we need to do is we're gonna do a blood panel to look for things I can't see on the physical exam, which would show us kidney, liver, glucose, and possibly catch a urine sample, because if he had a little incontinence, if it's because of his old age and his bladder can't control urine, I might switch the Proin to an estrogen to kind of make it work a little bit better. Sure. If it has something to do with other metabolic diseases, then we can address it. So if everything else has got a little tartar, little weight problem, lumps, we're not going to worry about those right now. But if I get the results on Monday, Tuesday, then I should call you and make some recommendations. But he's holding up just fine. Cool. I'm not worried about anything. He looks good. Do you mind if I have you go back to the room?
Sure.
Then I have the nurses come and do a blood panel?
Yeah, that sounds good.
Yeah, we'll call you. We might need to walk him and catch them. Thanks for being patient. Bean doesn't like it. Yeah. So I'll call you on Monday or Tuesday. We got urine. Did you collect that urine?
Yeah.
Yeah. First, I was actually going to have you come back for a urine sample, but we got the urine, so does not like being held.
Oh, he doesn't mind being held. He just doesn't like.
No.
Oh.
Restrain.
Oh.
Yeah.
Yeah.
When you cuddle him, That's different. Hugging him is different from restraining him for blood draw. But he did great. We'll just, apologize to him later. Say hi to your mom
so
for
you'll
me.
give me a call?
Yeah,
All right,
Monday or
thanks,
Tuesday.
Becky.
If you haven't heard from me on Tuesday, put in a phone call and say, hey, buddy, what's going on with my bean? Yeah. Yeah, I'm so excited to have you guys here. It's really honorable because one of the reasons I became a vet, there were two, but mostly one of them was when I was growing up, there was this one guy who came in our village, and I'm talking about, I don't know if you've seen pictures in Africa, and he was a vet, and I thought, he's really cool. I had no idea what he was doing, but I thought he treats animals, and he seemed pretty cool, and I thought, maybe one day. So I didn't even care about it, and then later on, my grandfather, who our tribe keeps cattle, I was doing science subjects, physics, biology, and chemistry. And my grandfather, who is really was my cool friend, he said, well, what are you going to do in science that we can communicate? And I said, I don't know. I could be a doctor for humans. I could be an engineer. I could be, I don't know, anything because I'm good at science. And he said, well, is there anything that has to do with animals that you could use? And I said, yeah, it's called veterinary medicine. Then he said, you should do that because then we can communicate. Well, he wasn't educated, and he was like, the only thing he would understand is animals. And I thought, if I do veterinary medicine, we can actually talk about the same things. That's really how I did it. And I thought, I'm going to do that. So that's how I became a vet. But here is a group of you guys. I'm so excited because you're starting really, really early than I started to think about career and profession. You are way ahead of where I was before I decided. And I'm very proud of you because you're really young, and it's never too young to start thinking about what you want to be. This is Rock Creek Veterinary Hospital. It's two things in one. It's the business, which makes you money and you live a good life. But it's also a building, which is real estate. Well, you get money out of it. So I own both. And I own the grooming shop across. Then I also own another hospital about 20 miles from here. So it's a good thing. I'm blessed. I'm blessed to be talking to you. And I don't know if you know or you heard about where I came from. I'm from Africa, Uganda. You wouldn't even see it right on Google, but it's like somewhere on the east side of Africa if you look at the map. The place is called Uganda, and it's a third world country. So for me to be here is a miracle. But it's not a miracle if you want to be something, and you being here is one of the process on how you could be successful. So I'm just going to brag. For a third world guy who grew up without anything to own these businesses is a big deal, and you guys should be a big deal in your head. And once you have it here, you'll be fine. The veterinary hospital. So there are several categories of veterinary hospitals. Some are like us. We treat dogs and cats. I was thinking about treating small animals. My wife does not like snakes. And if we started doing that, I'm not even good at it. She will probably never come here. We don't do anything but dogs and cats. And I'm not good with rodents and rabbits because they don't pay well. And I really want to be successful, have money, take my family on vacation, donate, have time to talk to you, promote my book. I wrote a book, and I just do things that I like. And that's a good thing. If you get educated, you make a choice on what you want to do. Some veterinarians do, which you're not limited. You don't have to do what I do. Some veterinarians are large animal vets. Others are cows and goats, and there are vets who work in public health. They're responsible for preventing rabies, diseases that come from animals that could be transmitted to humans, and they work for the state and the federal government. USDA, any food we eat, they will monitor and they check for diseases. So veterinary medicine is not limited to treating dogs and cats. You are scientists in the lab, you do research, you create medicines, and usually studies that are done to help people to create medications, they are started by a veterinarian and other scientists to create those meds for humans. So it's a very wide kind of open field. You could be a research person, you could be a chemist or something, or public health. So it's quite wide open. And once you do veterinary medicine, you could pick and choose zoo medicine. You could treat lions and tigers. And it's amazing. There's so much work in veterinary medicine. And then, okay, so there is a tendency in Colorado, or mostly in the United States, to not see a lot of people like us, African Americans and Africans, career in veterinary medicine. And I don't know why, but I think it's because of the proportion of the population. But it's also something, when you see one, I get excited. I'm like, there's another one. And me being here, it represents a good population of people who are not vets. There's a few here, but I'm really proud to be one of the vets, black vet in Colorado. And it's kind of like a privilege. Where I come from, dogs and cats are not treated the same way we treat them here. They're kind of like, they stay outside, they eat food, whatever is left over. Pets here are treated like humans. We do blood work, we do everything. I do surgery, remove organs, transfuse blood. We do everything. We haven't got to organ transplant. Cornell University is doing that. We treat cancer, we treat all sorts of diseases just like in humans. So it's kind of a cool thing to do. What does it take to be a veterinarian? It's pretty easy, but not easy like, you got to put in some work. So if you do your school after high school, you graduate high school, then you could go to an undergrad school, but you have to have some basic sciences, either biology, chemistry, physics, a little bit of math, but it's not really complicated. So after high school, you do undergrad, and then you apply to veterinary school. If any one of you ever applies anywhere, come here, I'll give you a good, high recommendation. And I've been lucky, most students I recommend get to Colorado State University, and they get a position, they get allowed in the university. So it would be an honor if you were in college, and I heard that you were going to a vet school, come get a recommendation, and you could do an internship here. It would be exciting. So that's how you become a vet. And once you finish veterinary school, there's a test you do. It's a national board exam. It's easy. You do it, and once you pass, the state also gives you a license, and then you start making money. And then you use that money to buy things you like, build businesses, and go on vacation and help other people. Okay, so the other thing I wanted to kind of chat with you about was, and I'm sure you have questions, and I'll have plenty of time for you guys to ask some questions, but I thought I should kind of talk about minor things that are kind of basic to the profession. So why do I enjoy being a vet, or why did I become a vet? One is it's just a career that, like I said, my grandfather liked, and I did it. The other reason I did it is it pays me really well. I'm really successful. I own 3 businesses. I have just enough to take care of my family, my extended family, do whatever I want, but also help people. There's a lot of people that need help, and if you have a job that pays you well, you feel really, really good about donating, extending your finances to somebody. So when you study, part of it's not just like making money, it's just about what can you use that money to do. So we support a lot of charities. We help a bunch of rescues for dogs and cats. We have human charitable organizations that we support, my wife and I, and that comes from the money I make as a vet and from my businesses. So what they don't teach us in school is be a vet, be a dentist, be a doctor, work hard. What I'm gonna tell you is, yes, that's perfect. But once you get some foot into the job, try to own your job. When you own your own job, you do a lot better than if you are always employed. It's okay I was employed, I delivered newspapers, I cleaned houses. but the goal eventually was to own my own business. It's a miracle once you switch to that position. Oprah, maybe you guys are too young, you never saw Oprah. She used to work for a TV station, and then when she owned her own studio and she owned her own shop, she became a billionaire. She's one of the most celebrated Black African American, and why not be that? Now, don't jump to that. You have to learn how to go through school, because school takes you to wake up in the morning, have to go until 5 or whatever, 3. It's like I told my boys, they would have been here, by the way, but Ian, who is 14, has a basketball game, and my 17-year-old, drove him because he's driving. So that's why they're not here. But I usually tell them that school is a training for your job when you work for somebody, because you have to go into work. And that work is your training for how to run your own business, because you have to work harder, twice as hard as if you work for somebody. So you are in the right process. If you're in school, waking up at the right time, finish your homework, is the same way you do for your own job or your own business. So anything you're learning now is just what you do. Once you own your own business, that's it. You'll be really successful, and then start helping other people, teaching other people how to do it. What conditions do we treat here mostly? In dogs and cats, everything. We'll talk about incontinence, which sometimes pets pee out of, without controlling it. Talk about senior dog diseases, the arthritis and cancer and skin conditions, dental disease, heart conditions. We just talk about how this guy had an echocardiogram. So I'm like a general physician. I will treat most things, but if I can't treat it, then I'll send it to a specialist. That's the difference between veterinary medicine in the United States versus in Africa. Dogs have cardiologists, they have oncologists, they have nephrologists, people who treat the kidney and blood and everything. So we treat blooded areas, skin stuff, everything you can think of, glaucoma, eye issues. Then I also do surgery for if they have a lump, if they have a tumor on the spleen, if they have other things, or like a cut, if they were running and playing and they had a cut. So that's all part of our job, plus a lot more. If part of this place, if you see down here, right there, those are dental machines. We will clean their teeth. Obviously, we have to sedate them. That's the difference between humans and dogs. That's a whole dental machine. Back there, somewhere, we have a dental x-ray. We take full mouth x-rays, and we do everything like they do in human dental offices. In there, we'll show you, it's an x-ray. Most times, pets swallow, eat stuff they're not supposed to eat. And we take x-rays. If it's there, then we take them to surgery and go ahead and remove that. Sometimes we take x-rays to see an enlarged heart, or some swelling in the abdomen that could be a tumor, or other reasons. So everything that you see in humans or you've heard of, we do it too. So a veterinary hospital is kind of like a human hospital. There's a vet or vets, doctors, who treat animals. There are also support staff. In this hospital, we have me and 3 other vets that come in during the week, and we treat animals. But the hospital, even though I own the business, I have a hospital manager who runs the business part of it. That includes the money part, payroll, that she hires and fires. And if I'm not comfortable with one of the employees, I don't actually deal with it. I just kind of make a recommendation. If I need more help, I ask her to hire somebody else, and she'll hire doctors too. Then so that's our hospital manager. Then we have the nurses, or in veterinary medicine, we tend to call them technicians. They do what nurses do in humans. They run blood, check blood pressure, temperature, get the history. Then we also have the people who answer phones, no different than a human hospital. And so that's what happens in this whole building. Okay, so we've talked about what the hospital does and what it's set up as. How do we determine what we charge for? So if you're gonna charge, like a physical exam, someone who comes in and they want me to see their pet, it costs them a certain amount of money. The way I determine that is you have to see what other veterinary hospitals are charging. Then you don't charge too less or too much. because they will go to the other hospital, and then you won't have enough clients, then you won't pay your bills, and you won't be successful. So we kind of charge moderately based on what other hospitals are charging. We also buy drugs. Some of them, 60% of them, are the same drugs they use in humans. So if you buy a bottle of some injectable medication for like, let's say $50, it's called markup. You increase the fee by 1.5 sometimes to just get a little profit, not because you want to rip off people, because you have to pay for electricity, the building. So if you guys, in your time when you're not in school, you want to start selling candy or something, if you go and buy it at Walmart for like $1, you want to sell it at $1.50, because your work to go there, your time is extremely valuable, so you charge just a little bit more to pay for the extra candy and get that profit. So that's how we kind of determine prices. And then the employees, it's kind of a tough season right now. There are not many people who like looking for a job. So when we need an employee, technicians, front desk, we have to pay them well, or else they're not going to come and work because there's another hospital that could pay them better. So it's kind of like you gotta compare prices with other competing businesses. That's how we determine, prices. Now, generally speaking, our hospital has been really lucky, and it's not luck, it's all what you do that creates a reputation for somebody to tell somebody about you. We don't advertise a lot. The way we've grown pretty fast because, and this is something you should do in your daily life, hopefully. You work hard, and especially, I'm gonna say this, now for us, African Americans, you have things that you have to do better or even a little bit better than the other person, because you're not, expected to do that good, and once you do better, you draw attention to you. Once you draw that attention to you, you become the favorite. So what I'm gonna tell you is, if you say somebody studies for 6 hours a day, if you actually outstudy them and study 7 hours a day, it doesn't matter how smart they are, you do better than they do. What I do for my businesses is I work harder than what I think an average vet does. I don't have to do more physical stuff. I'll see more appointments. I'll skip a lunch break if I have to. I will see more urgent care if some other people are like, oh no, I don't have time to do this. I want to take a break. I'll skip it. Because then the other thing I do is honesty. A lot of times, some stereotypes come in the way, and once you beat those stereotypes, if I'm 100% honest all the time, Monday through Sunday, year in, year out, you're not gonna have a reason to put me in a box, because everybody will say Patrick Kalenzi is quite honest. If I do a good job, if I charge fairly, if I portray myself as a profession and I create an impression of professionalism, I will not be different than any other person who is in the same profession. But I keep in mind that there's always a possibility of someone thinking I can't do something. The minute they think I can't do something, then I'm gonna do it and do it even better. So honesty, hard work, outwork somebody else, you'll be fine. And that's what has grown my business, and I've been lucky. That's what I have. And then the other thing I wanna say is we'll walk you around and show you some, like the surgical room, the x-rays. We'll show you maybe an x-ray picture of a dog. And then if you have questions, I'll be really happy to answer. But I want to tell you that for you guys to already start off by wanting to know what this field is or other fields is just a sign that every single one of you is going to be okay. It's going to be successful. So that's my thought about it, about you guys. And I appreciate you so much for coming to listen to me. Now, before we show you around, do you have any questions? Yeah, thank you. I never get clapping. Cats and bark at me. Cats hiss at me. Dogs bark at me, so thank you.
So this one is just for surgery?
Just surgery, sterile surgery. Nothing else happens here. Matter of fact, during the day, unless if you have a surgical case, yesterday we had 5 surgeries. So actually that, I should tell you about what happened yesterday. So you see how we were busy just when you came in? That's nothing. That's why I said, well, we should meet on Saturday because it tends to be a little lighter. But during the week, yesterday I had a specialist. So I'm a physician for dogs and cats. But if I have a patient dog who, the common injury in young, strong dogs is a knee injury where they'll rip the tendon that joins this part of the leg, which we call the femur, to this part of the bone called the tibia. They're joined by a ligament called the cruciate ligament. If they run and stop suddenly, if they jump and torque their knee, like football players or soccer players, it's a common injury and they kind of actually rip it a little bit. Well, there's nothing that can fix it. No brace, no medicine. We have to do surgery. So I bring in a specialist, an orthopedic specialist, to fix that. So yesterday he had 3. And then we had another dog that had cancer on the tail. So I had to actually, it was kind of spreading. So the solution for that is to amputate the tail. So I did that. We also had another one who the owners didn't neuter the dog earlier, which it's okay. But for male dogs, if you don't, sometimes the prostate enlarges and that dog wasn't able to pass urine. So I had to do an immediate emergency neuter and put a catheter so he could pee, because if you don't pee, it's an emergency, it's a crisis. So we did that as well. Then we had a dental cleaning. This dog had a lot of terrible teeth, really bad, and we had to extract like 5. So we were kind of busy yesterday, yeah. That includes, so that's in the morning mostly, and then in the afternoon, we see routine medical issues. Vomiting dog, sneezing cat, yeah, old cat with kidney disease. So yeah, we tend to kind of run busy. If you come in during the week, it's like 4 technicians, 2 doctors, and 2 front desks, so it kind of gets a little busy. It's fun though. I'm here, yeah.
Can a human catch something from a dog?
Yes, there's 5 common diseases that are transmitted between humans and cats or dogs. We call those zoonotic diseases. Matter of fact, we are the first line of defense for diseases that come from pets, because one of them is rabies. That's why rabies is legally required by the state. All states in the United States should have, if you have a domestic animal, you are required by law to have a rabies vaccine for that pet. So that's one, because if a dog gets into a scuffle with a wild animal, or a bat bites the dog and they catch rabies, if they bite a human and the common symptoms being aggressive, that will get to a human. It's such a bad disease if you don't get it taken care of. Ringworm, which is common in cats, can be transmitted between both humans and dogs. Hookworm and some kind of worms, if your immune system is down, you might catch it from eggs that you may not know they're on a pet, and you may kind of get your hands around your mouth and you could have those. There's another condition called leptospirosis. It's a bacterial disease that if pets go out and they kind of sniff urine from a wild animal or another dog and they catch it, if you get in contact with that dog's urine, which is pretty easy because our dogs sit in the couch. So after they pee, you never know if you have your hand around where their butt was. And if you grab something to eat, well, you'll be contaminating yourself. Humans can catch leptospirosis and it damages the kidney and liver. I think I'm forgetting one more disease or something, but there's just a few. Yeah.
Thank you.
Yeah. Can I say to Dr. Gabriela? Okay. I think it's MY.
Yeah.
Uh-huh.
Koniatis.
Perfect.
Yeah.
Thank you. Thank you, Dr. Carnes.
you.
Appreciate everything.
He's very interested in veterinary medicine.
Please come back anytime, any day.
I know you through Hattie and you.
Oh,
so,
wait,
it's been a
yes.
very long
You know, I
time,
didn't even
though.
recognize you.
It's been many years.
Oh my
probably since before
gosh. I
COVID.
had no idea you were coming with the group.
Yeah, well, it was wonderful. I'm glad.
That
I
is
had a
so
chance to talk to
crazy.
them.
I'm glad
I
you
know.
said that.
Yes.
Thank
So
you.
I'm
That's
glad I was
awesome.
able to make
I'll
it.
tell them that you are here. Thank you so much. All right, man. Take care.
It's so neat that they could just look at another
And
profession.
this is home for them. So if they're driving by or they have the thought that I can just stop by and see what's going on. Yes.
Thank you so
Thank you.
wonderful.
Thanks for doing all the work.
Oh, sure.
You take care.